Welcome to This Week in Health IT events, where we amplify great ideas with interviews from the floor. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. We want to thank our founding channel sponsors who make this content possible, HealthLyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. Over the next 3 weeks, we have a huge treat for you. I'm really excited about it. I just got back from the CHIME Fall Forum in Scottsdale, which was a great event, and we caught up with 12 active CIOs from various size health systems and asked them to take a look back at 2019 and a look forward at 2020. You're going to hear what they're excited to have accomplished last year and what they're looking forward to accomplish next year. I asked each of them the same 8 questions, and I think you're going to be fascinated to hear the similarities and the differences based on where they're at, geography, and other things. Each of these interviews is about 10 minutes long, so you can listen to them really quick, and some of you listen at 1.5 times speed, so it's going to go like that. We're going to publish one a day with a few Newsday episodes sprinkled in through the end of November, so check back every day for the next episode, and don't forget to look back to see if you missed any. Our next guest is quickly becoming one of my favorite CIOs, Nassar Nizami. He has been on the show, this will be the 3rd time he's on the show, and I had him on with a special episode with him and his CEO, Dr. Klasko, and that was a fantastic conversation. I got a chance to sit down with him again and talk through the 8 questions that we're asking all the CIOs, and I love his pragmatic approach to IT, and I think you'll like it as well. Hope you enjoy. All right, so another session from the CHIME Fall Forum, and what we're doing is we're sitting down with CIOs like Nassar Nizami, former guest of the show. I appreciate you coming on. Thanks.
Sure, always a pleasure.
What we're gonna do is take a look back and take a look forward, and I'm going to air these in December, so it's going to be sort of a retrospective in 2019 and looking forward. The first question we've been asking people is, how has the role of the CIO changed just this year?
That's an interesting question. I think I see 2 trends. One is where in organizations where CIO role is to a certain degree diminished, and you see roles like Chief Digital Officer, Chief Information Security Officer, Chief Analytics Officer that are peers for CIO. And the second trend, which is very encouraging, is the role of CIO has been elevated in organizations where they're seen now or they become business leader. And mainly I attribute it to the digital transformation and the leaders who are able to really demonstrate that they can transform organization from a digital point of view are really at the table now.
Yeah, absolutely. Yeah, we're seeing that across the board, and a lot of the sessions are addressing that. One of the things you talked about, strategic, the CIO is still at the center of strategy. The data still falls under the CIO, and even though some innovation does, there's an awful lot of innovation that happens everywhere in the health system. What are like 3 priorities that Jefferson Health is looking to do next year that Health IT is being asked to support?
Great question. So Jefferson is growing by way of acquisitions, inorganic growth. And one of our top priorities is to integrate the organizations that are part of Jefferson now, or Jefferson family now. That's one. And second initiative that I would say is associated with integration is the implementation of our core clinical systems, all right, which is a set of EMRs and ancillary systems that we are deploying. The third initiative where I think Jefferson differentiates itself at a number of other organizations is in the area of innovation. That is going to be a top priority. This has been a priority for us, and it's just more of a priority going into 2020 for us.
Yeah, I really appreciate you and Dr. Klasko giving me the tour of the vault. Was really interesting. But also just the discussion around the number of health systems you have to bring together is significant. So do you envision a common clinical platform across all those hospitals?
Absolutely, yes.
Yeah, I can see that. And then you have Tom, your new CTO, working on a cloud strategy to enhance the infrastructure. Because when you bring that many organizations together, you it changes things overnight.
Absolutely. Think about it this way, right? I mean, so even though our strategy is to put one standard EMR, but we are continuing to acquire organizations. So we will never be in a situation where we'll all be on one platform.
Right.
We just understand that, right? So there is a degree of expertise that we need to develop, and we have developed to work in a multi-vendor environment, right? But the goal that we set 2 or 3 years ago was very standard organization standard set of back office applications, HR, clinical applications, and we are executing on it. But again, look, I mean, things change. We acquire more organizations, and every time we acquire, it's a new set of systems. Yeah.
I think since the last time I interviewed you guys this past summer, that you've acquired more.
Yep.
Yes. It's amazing. So the next two questions really are around focusing the question, maybe getting a little more narrow. And so what's one initiative that you're doing at Jefferson Health that you think is going to significantly impact the patient experience?
So I'll answer both your questions. Is that all right?
Sure. And then the clinical experience.
Yes,
sure.
Clinical experience question, because I think they're related. So I think for us at Jefferson, we have been operating with multiple set of patient portals, communication equipments, apps, patient-facing apps, EMRs, both inpatient and outpatient. We started with 9 set of EMRs, just EMRs, and forget about revenue cycle, etc. Right? And I just believe that by having, and we're already seeing this, by having a standard patient portal where physicians can respond to patients, or we can send them labs in a timely fashion, so allow them to book an appointment and so forth, it is already translating into a much better patient experience. We're seeing a much better adoption. We had portals for the last several years, right? But with the new standard portal, and along with it, set of apps, wayfinding, etc., right? The standardization, I think, is paying dividends both for clinicians and our patients. And for clinicians, it's a win-win situation, because as a system, we were never able to exchange data in a seamless way. We always exchange data, CCDs here, some interfaces there, but it was very, patchy at best, right? One patient record, one patient record. That's our motto, right? And that's how we are building system. The patient experience have increased quite a bit, right? I mean, look, EMRs are not perfect. There is no single EMR that is perfect, right? Yeah. We have all the challenges of our typical EMR, but just going from multiple systems to one standard build. So it's critical to I think differentiate that we have one build, one product, right? I think is the key for both patient experience for us and clinical experience.
That's fantastic. We'll get right back to the interview in just a minute. I believe the healthcare CIO role is one of the hardest but most rewarding jobs out there, but I'm aware that many CIOs live in a state of feeling overwhelmed. It's just not good for anyone to live in that state for too long, and the mission is too important to continue to have this high of a turnover in the CIO role. I've been in your shoes. The month I took over as interim CIO for a 16-hospital health system, the data center had just had 8 outages in 6 weeks. We experienced a data breach, and I was informed that everyone in IT had their resume on the street. How's that for month number 1? That year, we launched a major cloud initiative, set clear IT career paths, launched IT University, and started a 2-year project to consolidate 9 disparate EMRs. In addition, we participated in the launch of 2 successful health IT startups. The internal satisfaction with IT jumped over 15%, and IT staff satisfaction itself jumped over 20%. I had a coach every step of the way, and it was invaluable to me. A coach is someone who helps you to organize your thinking, keeps an eye on the industry for you, encourages you at times, and challenges you at other times. But above all, a coach is someone who is committed to your success, someone who is in your corner. I coach new leaders and longtime leaders alike to be more effective because your role is too important. I would like for you to schedule a free discussion with me to see if coaching makes sense for your situation. It's really easy. Just go over to healthlyrics.com and click on the schedule a free consultation button. I wish I could coach every healthcare leader in the country, but I only have 2 openings for coaching clients left for 2020. So if you think this might be something that would help you to thrive in the new year, head over to healthlyrics.com today and schedule some time for a discussion. So As you look at 2019, what's the one thing you're probably most proud of your team in having accomplished?
Okay, I mean, there are many examples that I can give, but I can tell you, from a budget and from just impact point of view, we implemented EMR. Okay, it is a very expensive undertaking for us. A lot of hours put. And what we are very proud of is that it was on time, it was under budget, okay, and we hit top quartile metrics in a number of areas. It was, we were very proud of the execution that went, and the goals that we have set, we surpassed all the goals, our internal metrics and so forth. And frankly, in a very short period, we were able to steady the environment, and our colleagues in clinical areas are actually seeing the results. They're able to, our compliance with bedside medication, and things of that sort have really shot up.
So that team that did that just moved to the next hospital, and now they're going to move to the next. Is that how it's working? Or
yeah. So look, I mean, like many other organizations, it's a journey for us, right? Yeah. So you do once, you do twice, and now we are now in a mode where we know that we are going to be doing these implementations for quite some time to come, right? And we have an organization to run, and we have implementations to do. So I think we are improving and we are getting better in just doing that. We will continue to bring hospitals on, but at the same time, we have to do statistics. And that's critical because our first implementation was all about implementation. There was no optimization, there was no steady state. And so we were all focused on optimizing implementation. This was, I think, a mixed bag a little bit. We did more implementation than optimization. I think our next one is going to be more steady state optimization, and our focus implementation actually is getting less and less. Just because we have learned a lot, we have leaders who understand, and it's just, you keep doing it, you learn from it.
Yeah. And you guys, very successful implementations, and now you just get to replicate that, which is that's fantastic. The thing I'm looking forward to is the point at which Philadelphia was a very fragmented market. Yeah. It would be great to have a single patient record across all of Philadelphia. I mean, before there's how many academic medical centers, how many different hospitals. So it's probably one of the markets that I look at and say, consolidation's welcome, I think, in that market to the patients, I think. So let's talk about, now I have this phrased, people have told me they don't like the way this one's phrased, so I'm going to ask it a little different, which is, what's one thing you wish you had more time to spend on in 2019 that you just didn't get around to because there's so many other priorities?
So I'll tell you, so we talk, and I genuinely believe that AI, machine learning, and RPA, this is our future, and this is where we can truly differentiate ourselves. We knew going into 19, right? Like if you back up to December of last year, all right, that we should be looking into RPA because there's some real savings tied to it, right? And with all that's going on, we just were not able to give it the right time and attention. We became a pure bandwidth issue, right? Yeah. And in hindsight, I wish we would have done more work to at least get it started. We've started, but we are not at a point where I wish we were.
Yeah, we talked about Daniel's session yesterday, and Daniel's been on talking about New York Presbyterian's RPA journey, and it's really interesting. I mean, they're really sort of out there setting the bar.
Absolutely. I mean, absolutely. Like I was at Presbyterian once, it's a great organization, and Daniel is doing great things there. And certainly, there are a thing or two we can learn from them. Absolutely.
So pick up your phone call, and you can compare notes, which is great. What's one area that you wish the industry, you would like to see the industry innovate more? Mm-hmm.
So look, Jefferson has made a name for itself, mostly because of our CEO, Dr. Klasko, who has such a great emphasis on innovation. I talk to vendors all the time who basically talk about patient engagement, patient experience, etc. I'm not really seeing any real innovation in this space. I mean, there are nice tools, right? Yeah. But basically, in my opinion, they're a redo of same portal. We're going to do an app, and It's same concepts for the last 2 or 3 years that people are sort of, incrementally improving, which is really good. So I'm all for incremental improvement. I mean, there is a lot of value in increment, but I have not seen innovation, all right, in patient engagement. And as a matter of fact, there are studies now that show that things like MyChart have not really contributed to patient engagement or improvement to the degree that everyone thought it would. There are certainly, people who use tools like MyChart or patient portal, I should say, and apps are doing better as patients, but we really have not seen the true innovation in the area of patient experience.
No, that's fantastic. So the last question, we did a poll of our user community.
Yeah.
And one of the things they wanted me to ask CIOs more was because I think there's some college students out there wondering, where are you going to be hiring? And the question is just, what health IT roles do you anticipate hiring in 2020?
So for us, Jefferson, we are hiring across the board, first of all, I would say. But the two areas where I think I think that there is growth, and if you have students listening to your podcast, I would say cybersecurity, all right, continues to be a hot area, and I think will continue to be an area where high demand for probably a few years to come. And second, for us at least, is within the space of EMR. So folks who with some clinical background that understand clinical workflows and so forth and can translate that into IT. Those are the two areas I would say we are going to be hiring in 2020.
Cybersecurity, yeah.
Yep.
I definitely can see that. Nassar, thanks for taking the time. I appreciate it.
Always a pleasure. Thank you very much.
Take care. I hope you enjoyed the conversation. Remember to check back often, as we are going to drop an episode a day for most of November of 2019. Following that, please come back every Friday for more great interviews with influencers, and don't forget, every Tuesday we take a look at the news which impacts health IT. If you want to support the fastest growing podcast in the health IT space, here's a few ways that you can do that. The first, share it with a peer, share it with a friend, share it with somebody who's working right there next to you. Number two, sign up for Insights and Staff Meeting. These are services designed to help you in your career. Number three, interact with our social media content on Twitter and LinkedIn. Number four, post or repost our content. And number five, always send me feedback, bill@thisweekinhealthit.com. Your insights continue to shape the channel. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or our YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.